Left of the box. From Tina, I asked Premier, she's a reporter, I asked Premier Ford about plans to expand pharmacists' powers. Critics say it is yet another way his government is privatizing the healthcare system, putting money into the hands of large retail chains. I totally disagree. The docs don't have lack of customers. Full response.
Tina Yazdani asked Ford about that and joins us now with his answers. Tina.
Yeah, Cynthia, that announcement last week didn't sit well with some Ontario doctors as well as critics who are concerned about where that public healthcare funding is going. So pharmacists could soon treat and prescribe for 19 more common ailments like headaches and shingles. That's on top of the 14 they can already treat and prescribe for, like pink eye and UTIs. But the Ontario Medical Association tells me with 2.5 million Ontarians now without a family doctor, the government's priorities are all wrong and pharmacists cannot replace physicians. Pharmacists also charge OHIP $19 a visit, so almost $20 million has been siphoned away from family doctors since these powers were handed to pharmacists last year.
Pharmacists can't refer you. You know, they can maybe say, oh, well, try this medication, but if you need to see a specialist or get something investigated, they can't help you. This is not a solution at all. Like, it would be great if this was maybe on top of everyone having a family doctor. Like, if we all had access to family doctors, but you know what? You wake up in the morning, you have a bit of a sore throat, you go into the pharmacist, yeah, sure, it sounds like this, here's this. That would be fine, but we are so far from that in Ontario right now. Millions of people without a family doctor. And as I keep on saying that they never report on in mainstream media, that doesn't include the people with family doctors they don't like or they don't really have readily access to.
I asked the Premier about the concerns. Critics say this is yet another way your government is privatizing the healthcare system by putting money in the hands of these large pharmacy retail chains. How do you respond to that?
Well, I totally disagree. You know, we're backlogged. It's not the docs don't have a lack of customers. If I had $1 for every time someone said I need to get an appointment with my family physician, I can't get it. Over 1 million people have gone to pharmacies for 19.
Why can't they get an appointment with their family doctor, Doug? Huh? Why? Why is that a problem? What could you do about it? You know, having pharmacists available is not the solution because, yeah, people go to the family doctor for things other than a UTI.
Prescriptions, and we're expanding that. That's 1 million people that don't have to go to their family physician and tie up their office for simply something like pink eye or other.
They should be able to go to their family doctor because the family doctor would be able to determine if maybe it's something a little bit more severe than just the cursory, oh, maybe it's pink eye. It could be something else.
Areas that they need a prescription. It is one of the most popular things we've ever done.
Doctors, of course, say that it is popular because a lot of Ontarians, 2.5 million of them, in fact, do not have a family doctor. Now, the Ford government also says this will result in overall savings to the healthcare system.
It's kind of like saying water is a very popular beverage. Yeah, it's because you kind of have to. You have to drink water. You know, it's like, oh, these pharmacy programs, it's really popular because people are desperate. They're desperate. If there is one thing my channel can accomplish, the thing that I want to make Canadians aware of the most is what is happening to our healthcare system. Which is so frustrating.